You know, here on Sonoran Living, we do the New Year, New You show for a reason. Well, first of all, it's the new year, time to set some new goals, but it's also time to focus on you. You know, it's been crazy the last several months. And if you've been feeling a little out of sorts and you've put yourself on the back burner, it's time to focus on you. I may have some help for you today. I am at Tutera Medical along with Dr. Mel Schottenstein. First of all, good to see you.
Nice to see you again.
Yeah, Happy New Year to you.
Thank you. You as well.
Thank you. You know, a lot of us women, we take care of everybody else. And as we get a little bit older, things change and we kind of ignore those feelings, those emotions, those symptoms. Here at Tutera Medical, you focus on helping women through bioidentical hormone replacement therapy.
That's right.
But there's also hormone replacement therapy. So
That's right.
Can you explain the difference?
So one is using hormones that are natural, that match our own body's chemistry, and the other, they're synthetic, and which have many more side effects that people need to be concerned with.
Oh, okay. What kind of side effects?
Well, there's higher risk for cancer. It's going to be stored in the liver. It can have toxicity over time. So because of that, that's why we don't do those type of hormones here at the clinic.
It's the bioidentical.
That's correct.
That we need to really focus on. So a lot of women think, okay, well, you know, I'm getting older and, you know, this is just going to happen and it's supposed to happen. But that's actually not the case. And it's really not necessarily for older women either, is it?
That's right. Actually, there's a lot of people who can benefit from hormone therapy. There's people with endocrine disorders that could benefit, men with low testosterone, transgender individuals, people who have maybe Parkinson's disease or even traumatic brain injuries.
Wow, I had no idea. I thought it was just, you know, brain fog and you know, things like that. But that's really interesting. So let's talk about how, when somebody comes in, they might come in with a laundry list of symptoms. How do you determine if bioidentical hormone replacement therapy is right for them?
That's a great question. We look at their labs, we discuss with them about their symptoms, we find out a little more about their history, their gynecological history in the case of men, about their medical history as well, and then make an assessment to see if they're a good candidate.
Forgot about the men. I'm glad you brought that up because it's not just for women.
That's right.
I have actually talked to a lot of men who've received this type of therapy. How is it beneficial to men?
Oh, it's far more consistent than getting testosterone injections. You're going to have a pellet that's implanted into your skin that's going to give a continuous release of the hormones. So men don't have to get these injections of testosterone every 2 weeks or every week. That's going to give them a spike and drop right back down. Right.
And I want to talk about those pellets for just a moment because that is really what Tutera Medical is known for.
Absolutely.
Of course, because of Dr. Tutera. So what is unique about how you guys help people through this pellet?
What we do is create a customized protocol for each patient. So there is no one standard protocol for every patient. So instead a person comes in, we take a look to see what their levels are, what their weight is, their height, their level of activity, their stress level, really assess them and determine what they need.
So a pellet can be for everyone, but it's what's inside the pellet that you customize?
The dosage.
Ah, okay. Now, that will be great for a lot of people, but you know, there's some of us who still have some other issues. Yes. Can you help with that?
Absolutely. Actually, here at Tutera, we offer wellness visits, we offer thyroid visits, adrenal consults, weight loss. We offer other therapies to also help with sexual dysfunction, such as PRP. We can help both with male and female sexual dysfunction, hair loss, so we help with hair regeneration. PRP can also be used for joint injections, restoring joints. We have peptide therapy. Peptides are actually another form of hormone, but act a little differently than the sex hormones that people get with pellets.
Boy, hormones are so important to our overall health, aren't they?
They are.
Wow. All right. Well, good information. We appreciate you, Dr. Schottenstein. Thank you so much. And here's an amazing special offer for you, too. Dr. Mel Schottenstein is offering a new patient special holiday rate of $185. Tutera Medical is located at 8412 East Shea Boulevard, Suite 101 in Scottsdale. You can call 480-874-1515 or visit the website to learn more, tuteramedical.com.